Welcome to Innovators, a series where we sit down with thought leaders in the healthcare technology space to talk about trends that are impacting the industry today. My name is Justine Giancola. I'm on the corporate communications team at Inovalon, and joining me today is Kimberly Swanson, the Chief of Staff at Healthmine. Today, we're going to talk about data-driven healthcare and its impact on the patient journey. Thanks for being here today, Kimberly.
Thanks for having me.
Of course. So let's get started with, we know that data-driven healthcare is increasingly top of mind for health plans. So tell me a little bit about what data-driven means to you.
Absolutely. Data-driven healthcare is all about personalization. So, nothing is more important than getting accurate and real-time data on a person or a member to make it truly actionable. So that is really what is going to drive the health plan's tactical strategies to engage with their members, whatever ask it is, gap closure, going in to see their PCP or take a survey. It's all about that accurate data to tell the right story about a person.
So, and you kind of answered this, so how would you define that good data, accurate data, and why is being so clear on that definition so important?
Yes, absolutely. Good data is comprehensive and complete data. So that data really needs to include clinical data on the member, their medical, their pharmaceutical information, their social risk factor data, what barriers that they may have to seeking health care, as well as self-reported data. And that definition is getting more and more important because there's just higher standards in government reporting and gap closure on data. So it really needs to be all-inclusive of that member to tell the complete picture of that member, for the health plan or any of their partners to be able to engage the member, to get them to do anything, whether it's to change behavior. Ultimately, all of us are in this to keep them more healthy. But that good data really has to be complete and accurate.
Absolutely. So, then we get this full picture. So trickling it down, how is it then helping improve that member experience as they're going through their health journey?
Yeah, absolutely. So, the patient and member's, health journey is very, very fluid. So, when a member first, might answer certain questions about their health or their social risk factors or things like that, it can drive their journey from the beginning. But quickly, health statuses can change, your life situations can change, and that data needs to change with that member. So you really need to be, again, really looking at that person and their complete picture. This is getting much more important in terms of health equity as well. So the data is not just data, it needs to be impactful and insightful and drive that journey. So, right from the beginning, you need to be able to engage your members with accurate data. If it's not accurate, it doesn't tell that picture of the member, if it's not in their language, you're going to break that trust, and then it takes a long time to build that trust. So you need to kind of really have a lot of insights on top of that data about the member and slowly drip that data to engage them. And not overwhelm them from the beginning. So really capturing your communication preferences, their language, how they want to be communicated with from the beginning, making sure it's culturally competent, you're following digital health literacy standards, all of those type of things. And then you can really build that trust with the member and engage with them in their language and the way that they feel comfortable, and then talk to them about more vulnerable things like going into the doctor, getting mammographies, talking to their doctor about all of their healthcare concerns. So, as top of mind for many health plans right now is the Health Equity Index, and they're, really driving that gap closure at the measure level for vulnerable populations, and that comprehensive, complete data is the core of that.
And I love that there's so much focus on that member, that patient at the end of all of this, because we talk a lot about healthcare technology data and how does it impact that person at the end of it. So love to hear that. And, we've seen the advancements that are taking place around data-driven healthcare, and, they've been incredible over the years, and would love to know, where do you think that we're heading from here? And then where can health plans and their partners even potentially continue to improve the data management and sort of harness that power of the good data that we're talking about?
Yes. Well, data-driven healthcare is evolving quickly. And this concept of interoperability has been talked about for many years, but we are really seeing it truly being actionable, especially in the health plan partners and the vendors all coming together to bridge that gap and making sure that we have all the right data, get better data, share it with the care team, the PCP, the specialists, all of those type of things. But health plans really need to be investing in tools to sitting on top of that data to really get those insights. And, all of the member-facing teams need those tools to do their job at the health plan or their providers. If you don't have it at your fingertips and it's not actionable, you're not going to be able to really connect with the member. And data-driven also means actionable. And what I mean by that is that we get a lot of insights. If this member hasn't gone to the doctor, they haven't gotten this screening, they don't have these things, but it needs to go beyond that. So if the member hasn't going to the doctor, we really need to engage with them most, at scale, digitally best, is saying, okay, here's a big easy button to do what I'm asking you to do. Click the button, schedule your PCP appointment with your own PCP, or if you can't get in, do it virtually with, comfort of your own home with the physician that speaks your language, things like that. This is getting more and more important, again, for health equity, because if you think about where the measures and the government is going, it's all about actual outcomes. So if you're screening for food or housing or transportation insecurity, it's all about surfacing an intervention quickly to the member to close that. Did you know that your health plan offers rides? There's a food bank down the street, all of those type of things. So it's not just surfacing something and knowing something about a patient or a member. It's about doing something with it, all about that action.
So really important that we're harnessing this data for good to ultimately impact these outcomes. And I'd love to know, do you have any stories or examples where you've seen people using this data to ultimately impact that outcome or journey?
Yes, absolutely. So when we're talking about the journey over time, a lot of it is just checking in with the member and engaging with them on these pulse surveys, 1 or 3 member check-ins on how are you doing. And, when you're asking a member about something like that, you need to be prepared to close that feedback loop. And so what we're seeing more and more is when you're engaging the member, around, have you gone in to see your PCP? And they engage, no, I actually cannot get into my PCP. There's an access issue. The health plan was easily able to see that within 1 day and call that member and talk to them about other options that they had. So we were able to identify an access issue. So the plan was able to, talk to the PCP's office to resolve that, get the member, an appointment that they really, needed to seek care, but then also, show the member that they cared about them. They heard them and they did something about it. And that really makes the member feel good that, people are caring about them. And so they're less of a member retention risk. So really everybody wins, through this continuum of care and sharing data, which a lot of the times it's clinical, but it's also, don't forget about that other side of that member and their satisfaction with everything that's going on. It's so hard to coordinate care. And an easy way to do it is just to ask the member things, get that data and then real-time action that and close that feedback loop.
This is really exciting stuff, Kimberly. It was great chatting with you today. I'm sure if we even reconnect in a few months, there will be even more stories and more to tell on the topic of data and its impact on healthcare and the patient journey. So really appreciate you taking the time today and the insight that you were able to share. And of course, to our audience, thank you for tuning in. Be sure to join us again next time.